Hey y'all, and welcome back to my channel. On this page, I talk about technology and money and sometimes trending news. If you are new here, you're very welcome to be here. And if you are a returning subscriber or haven't subscribed yet but are a returning viewer, welcome back. So today I have three very interesting healthcare technology stories and some commentary to share with you all. I'm excited to have come across. So I'm going to share my screen. If you haven't yet, and when you're watching this from the future, I do ask if you would consider liking and sharing the video. Liking and sharing the video does two things. Number one, it helps this content get out into the algorithm. If you find it interesting and engaging, there are other people, when you like it, that will find it interesting and engaging. It helps the algorithm work. And then number two, it encourages me to continue creating content that you all find interesting. So today we're going to be talking about healthcare accessibility in retail stores, in addition to some very interesting news that came out this week with ChatGPT, which is very hot right now, and how it relates to medical physician licensing exams. And then we're going to be talking about ingestible robots for humans. Okay, so I'm going to share my screen. Y'all bear with me. All right. So our first is really interesting. Is coming out of, let's see. This is coming out of, I wanted to start with ingestible robots for humans. Okay. Really interesting story here. Here we go. Can y'all see that? Okay. All right. So from Becker's Hospital Review. So Mayo Clinic, really interesting, has a new partnership with the startup that is making pill-sized robots. Now, pill cams are not new at all. But with this pill cam being a robot that is that can propel, as part of its robotics, and that's also the plan, because it's not on the market yet, has not been FDA approved, but to better help gastroenterologists, hope I said that right, better diagnose and assess gastric conditions is really, really interesting. So the story, Mayo Clinic is the main Mayo Clinic is based out in Minnesota, but I know they do have, they have a base down in Florida, and I believe somewhere else. So Mayo Clinic has gone into partnership or gotten a stake out of India TX. I'm going to pronounce it like that. And that's a startup based out in California that is making a robot the size of a pill to help diagnose digestive conditions. And so with this new agreement, this startup will, gastroenterologists at Mayo Clinic will help this startup refine and better make their product better. So the company is developing robot pills that can be swallowed. The company is developing robot pills that can be swallowed and move inside the stomach on their own, so providers can do upper endoscopies via a Zoom-like telemedicine platform. So it's almost like telenutrition as well. Yeah. So they have some words here from the CEO. The CEO of the startup. And then it's interesting because the CEO says, we're not having them develop intellectual property, but what we're doing is having them coach us clinically. Basically, this is a chance to make sure that the technology that we are developing is exactly what gastroenterologists actually need. So this is a new category in healthcare, which is micro robotics inside the human body. And I did a video last week about a hospital down in Florida testing out robots to help with the nursing shortage. And I said in that video, robots in healthcare are nothing new. Like when I started at the bedside over 20 years ago, we had a robot in our hospital. It was like a robot that just went back and forth to the pharmacy delivering meds. But just like last week, it being the first time where we're seeing robots specifically being used and tested to help with the nursing shortage. This is the first time we're seeing robotics inside the human body helping to diagnose and assess conditions. And so, as always, I'll be sure to leave a link to the articles and references in the description box. Now, they do have a press release from the startup. I'm not going to read through it, but I do want to just touch on very quickly this article that goes in a little bit more detail about the partnership between the Mayo Clinic and this robotics startup in the development of their micro robotic. So after months of negotiation, the startup and Mayo Clinic have reached a deal that will help accelerate the development of the robotic stomach camera. So it's India TX Pillbot robotic stomach camera. And again, this has not like hit the market. It is not FDA approved. They do talk a little bit about how they're testing this so far on cadavers. So the partnership is a know-how licensing agreement, which is going to give the Mayo Clinic a small equity stake in the medical device startup. There's some more words by the CEO. I'm going to skip over the quotes. And then, so this is the endogastroenterologist here at Mayo Clinic down in Florida. He's the chair of gastroenterology, and he's also a hepatologist. And he's on the board of directors for this startup. And so he's helped advise this company in the past. And so they do disclose that. And so they do talk about how the startup has already cadaver tested its Pillbot with this endogastroenterologist and this hepatologist in the past. But this new deal allows them to piggyback on that knowledge that has been shared and created in the past and take it a little bit further. And then have them be able to use cadaver studies help them use cadavers that have been donated for research. And they talk a little bit about the testing. So the testing is going to include back-to-back testing of that robotic ingestible robot against endoscopes to not only deliver an entry-level remote endoscope, but also to optimize the swimming camera's robot controls and interface. I'm so fascinated. I am so fascinated by this, y'all. I love reading about and hearing about how technology is advancing, how the creative ways that technology is advancing in healthcare so that diagnosis can be better, faster, and more accurate. This is fascinating to me. So the CEO of the company says, what we're making is not going to be the world's best endoscope. It's going to be the world's first virtual endoscope. So the whole point of this robotic endoscope is this effortless look inside the human stomach. So it's important that we test that out in a cadaver model before we move to live humans. They talk about it's a 15-year deal, which they're projecting to be enough time to do like a clinical trial, get approval by the FDA, and then also put it on the market. And so the CEO talks about wanting to show people, let's show people that you can drive little robots around in the body over Zoom calls. And in that new category, in that new world, figure out what the next step is. So, when I read that in the back of my mind, of course, I'm thinking, what about cybersecurity? I'm sure at some point they're going to have that conversation if they're not already talking about, making sure that, you keeping the patient's data safe, in addition to any regulations that the FDA may have around an ingestible medical device, similar to how the FDA weighs in on any device that is attached to a patient or any implantables. There are regulatory requirements around like implantables and things like that. But this is not an implantable, right? This sounds like something that will go in the body and come out versus an implantable like a knee replacement or something. The robot is not new, but they do talk about in this article what is new. They said now they have a 3-dimensional routed flexible circuit. So they have made the device smaller and more flexible. They says that their latest version is shorter than any pill cam on the market. Because like I said, like pill cams on the market, that's not new. But it has a diameter equal to or lesser than any other pill cam. That goes on to talk about how some of the research and development that they've been doing. And then how they will be testing out the latest devices. Now, the newest version will have batteries and propulsion motors on a flex circuit. That's really interesting. And they're saying that the assembly will eventually be as simple as popping the parts together and gluing the joint. They're talking about like the making of it. And it goes on to talk about a little bit of the mechanical engineering behind it and the electrical engineering. It goes a little bit deeper into the know-how licenses agreement and some advice from both the Mayo side and from the startup side. So I just think that's fascinating. I'm definitely going to be following this story along to see where this startup is, going to go and, when it gets to the market. So let's get into our second story. Now, our second story is really interesting. Because it touches on all of the chatter and all of the conversation that's happening around ChatGPT. So I'm going to share my screen again here. That's why I titled this part, The Artificial Intelligence Will See You Now. Okay. So this story comes from Axios. Now, this article is from Axios, but you can find more about what ChatGPT has done this week on other news outlets. I just selected this one. So here come the robot doctors. So ChatGPT, that's a generative AI, which, there are conversations happening within like academia around what ChatGPT can do, around literature, etc. Now, this is really interesting because they're talking about what ChatGPT is doing related to healthcare. So what happened this week is ChatGPT passed all 3 parts of the United States medical licensing exam. Barely, but it passed it. And it was all part of an experiment. And so the researchers noted that second-year medical students often spend hundreds of hours preparing for part 1 of the medical exam, while part 3 usually is taken by medical school graduates. Let me scroll down. So the interesting thing was about ChatGPT not only taking the medical licensing exam for, that medical students take to become a doctor, but it also passed it. But the interesting thing was that ChatGPT could perform so well without ever having been trained on a medical data set, right? Because, with algorithms, machine learning is just like the word said, is the machine learning. And the more data information you feed the algorithm, the smarter it gets, the faster it gets, the better it gets at diagnosing or making poetry or whatever it's writing. So they do have some caveats with the researchers. So they excluded a set of indeterminate answers, as it appears that the ChatGPT was programmed to avoid providing what could be construed as medical advice. But they're saying that those answers that got excluded were so general that it's hard to say if they were right or wrong. And then it goes on to talk a little bit more about generative AI, and perhaps maybe it could be applied to wellness checks and other general practitioner tasks. So will the AI see you now instead of will the doctor see you now? Okay. They do say, once this technology and using it in this manner moves beyond just like, understanding text, perhaps it could be used to incorporate data inputs like vocal tone, body language, facial expressions, right? Feeding that into a robot, perhaps. And one benefit could be the immediate incorporation of a patient's medical records. Sometimes physicians only have moments to scan a lifetime of charts. So what if you had a ChatGPT to read that patient's medical record and then give a synopsis to the provider before they go in to see the patient, right? So I know that there's AI out there. For example, there's Otter.ai, which is a tool that you can add to like your meeting sessions, your virtual meetings, like a Zoom, and you have the Otter.ai log into your Zoom meeting, and what the AI does for you, it listens to the conversation happening between the participants, and then at the end of the meeting, it can provide you a synopsis of that meeting without you having to take notes. So what if that same concept could be applied to providers with reading patients' medical records? Okay, so reality check. Don't expect the machine to autonomously diagnose patients anytime soon. AI models such as this sometimes make confident assertions that turn out to be false, which could prove dangerous in medical applications. I'm glad that they're recognizing that. And so that is it. They do say, bottom line, plenty of people rely on, quote, Dr. Google, end quote, for their medical needs. In the future, they may try to turn to Dr. ChatGPT. Who knows? Who knows, y'all? It's just really interesting. You know, the future of work, not only for nurses, like I've talked about on this channel before, is not only, you know, coming for providers. I mean, not only for nurses and, you know, nutritionists, but it's also coming from providers. So that was the second story. I thought that was just really interesting, especially with all that conversation that has been happening recently with ChatGPT. Okay, so the last story to me is a little bit of a feel-good story. Here, share my screen one more time. Okay, and I'm going to do a quick time check because I wanted to be here less than 20 minutes. Oh, good. We're great on time. We are good on time. All right. It's thinking about it, y'all. Just bear with me. Hang on one moment. All right. If you haven't and you're still in the video, if you could please like the video and also share it. Liking and sharing the video does two things. It helps the content reach more people, and it encourages me to create content that you all find interesting. So the last story to me is a feel-good story, right? Because I think about, you know, I believe that everyone has a right to have access to healthcare. To me, it's just a basic human right. People should all have access to that. But, you know, there are people who live in rural areas that may not have access to like hospitals or, you know, healthcare, etc. You know, in addition to that, like a food desert as well. You know, there's still people in the United States that don't have, you know, access to broadband. Okay. And, you know, combine all of that, you know, that could lead to like worse healthcare outcomes and other things. And also, this is interesting to me because you think about the whole concept of the hospital without walls. I've talked about it on this channel before. There's been, you know, there are more and more health systems opening hospital at home programs. And hospital at home is not your traditional home health care model. Hospital at home is acute level patient care in the patient's home, not in a hospital room. So to me, this builds on that concept even more with meeting patients and meeting people where they are. So Dollar General offers healthcare in 3 store retail parking lots. So this is interesting because Dollar General is a variety store. You know, Dollar General is not a mall. A variety store is another store like maybe a Five and Dime, a Roses, a Family Dollar. Those are like variety stores, okay? Where you can find just like a little bit of everything. Groceries, stuff for your garden, child products, clothes, and things like that. So Dollar General customers, and this is a new story here. Dollar General customers at 3 locations in Tennessee can now see a healthcare provider in the store's parking lot for preventative care, urgent care, and chronic condition management services. So Dollar General has partnered with Go On Demand. Now, I'm going to pause here for a moment because Go On Demand is not a new service. I do believe they have services up in the northeast part of the United States. I know they operate some up in New York and like other big areas like that. But this is really interesting because it is now in the South and in Tennessee. And so Dollar General has partnered with Go On Demand. So Go On Demand has been in existence, but now they have this partnership with a retailer. And, we have seen the growth of retail healthcare over the past couple of years, like Amazon. You can now get your prescriptions off of Amazon. That's retail healthcare. I know I saw a story maybe about 2 years ago where Best Buy was looking to get into that. Also at Walmart, there are Walmarts out like in Arkansas and other states where you can go to Walmart, go to the dentist, go to the doctor, get your nails done and all of that. So retail healthcare is not new, but it's just growing. What CVS is doing with the Minute clinics and Walgreens, etc. So the clinics set up in large vans allows patients to schedule online or walk in without an appointment. Is in Clarksville and Cumberland Furnace, Tennessee. So operated as part of Dollar General's DG Wellbeing brand. And we're going to look at that in a second because this Wellbeing brand that Dollar General has offers a lot of services. You can see here some of them, but I'm going to take you to their website here in a moment. But the clinicians can provide routine checkups, vaccines, lab tests, diagnostics, EKGs, wound care. You can also get your chronic disease management seen like asthma, CPOD, diabetes. It doesn't differentiate between type 1 and type 2 diabetes, etc. They have urgent care services that can treat the flu or COVID-19, skin issues, UTIs, urinary tract infections, abdominal pain, and more. And so it does accept major insurers as well as Medicaid. And it looks like the state of Tennessee has a Medicaid type plan called TennCare, because it says Medicaid/TennCare, and Medicare plans. They charge a flat fee for patients without insurance and collects the fee ahead of time. Again, I love this concept because again, it's meeting people where they are, right? So people may not have access to or be able to get to an urgent care, right? Or may not be able to get to a hospital, or may not have a primary care provider, right? But they can still receive health care. So just very quickly looking at Dollar General's Wellbeing brand, and I'm on their branded website. It says quick, easy health visits right outside the store. You can text. You can book a visit here on the website. You can text. So it shows all of the preventative care that you can get, urgent care services, migraines, incontinence, wound care. We talked about wound care. We talked about chronic disease management that you can get seen. And then it shows the locations here, all in Tennessee, right? And then it talks about where where the times that appointments are available. So I just think it's really interesting. I'm definitely going to be watching for more retail healthcare and just the expansion of that. I think about how what we're seeing with retail healthcare and what Dollar General is doing. Also with robotics, what this startup is doing with self-propulsed ingestible robots, how that can change nursing practice, right? I'm a registered nurse. I always think about how this ties back into the practice I do, not only as an informatics nurse or a nurse working in tech, but also for just nursing in general, right? Can you imagine being an emergency room nurse and you haven't heard of this technology, but the patient shows up and says, the robot in my stomach the robot in my body is making my stomach hurt, right? So as we see these technologies continue to be developed, it's just always important. I talk about sometimes about, nurses digitally upskilling and just preparing ourselves as these technologies are continuously being implemented in healthcare. That's it, y'all. Those are today's stories. If you made it this far in the video, please do like and share, and then leave a comment. I'd be interested to see what you say, your thoughts. All references to articles will be below, and I will see you in the next video.